to my channel. My name is Supasta, also known as Ora Anaboyega. I'm so happy to have you here with me today. I'm a pharmacist and a health and wellness advocate. I love everything health, everything wellness, everything career advancement, anything that helps you grow and do better. I am all about it. So today's video is going to be a bit of a chit chat. I just wanted to kind of talk a little bit about my experiences in regards to hospital pharmacy versus retail pharmacy, and the reasons why I left hospital pharmacy and how much I regret it right now. If you haven't been here before, make sure you subscribe, make sure you share, tell a friend to tell a friend. If you're somebody who's into pharmacy and just like growing your career, advancing, trying new things, then this is where it's at. If you are someone who's also into fitness, health and wellness, then you may want to also follow my Instagram page at @OraSuperstar. So I left hospital pharmacy in 2020, so 2020, last year. When I left the UK, I decided that I didn't want to go back into hospital pharmacy when I started practicing in Canada. That was for a couple of reasons, and more specifically because I really did not want to do any on-calls. Now, for people who are not from the UK or not familiar with the health system or how healthcare works, being an on-call pharmacist basically means that you're the pharmacist managing or running the hospital at night when everybody else is in their bed sleeping. Yeah. So basically, most hospitals that I worked at anyway, they basically closed up or closed shop at 5:30 or 6 p.m. on most days. And then that meant that from about 7 p.m. onwards, there would be an on-call pharmacist, and that pharmacist would run the show until the following morning. So that meant that anything pharmaceutically or medically in terms of drugs that the hospital needed, you would be in charge of ensuring that they get those medicines safely, they administer those medicines safely, and they're administering the medicines at the right dose for the patient. So that was, I mean, interesting, very interesting thing to do. But what I didn't like was having to wake up at 3 a.m., 4 a.m. and driving sometimes an hour into work. It was so tough. And I think that having to wake up the next day and go to work was just honestly just the hardest, difficult thing ever. So, you know, you'd be on call at night, you'd be called at 4 in the morning, 5 in the morning, but you would be expected to wake up the next day and go into work. Now, I know that that obviously isn't something that would run in every single hospital. Different hospitals have different policies and different, I guess, ways of working. But essentially, in all the hospitals I worked in, I just did not want to work as an on-call pharmacist. I kind of got to the point where I was like, my time is done with that and I don't want to do that again. So halfway through my career, I ended up being a contractor pharmacist anyway. So basically, I contracted my services to NHS hospitals, and I worked as a contract pharmacist for so many different hospitals. And I really enjoyed doing that because it meant that I was able to work in different diverse kind of sectors and areas. So I worked in mental health. I'd done a little bit of work with, liver patients. I was able to do a bit of work with community hospitals. It was so great. I loved doing it so much. So I told myself that if I was going to go back into hospital, it would be on the basis of the fact that I was contracting my services to a hospital, to a community, or to a public health area. Now, coming to Canada, I currently work and have been working as a retail pharmacist. I did work in digital pharmacy for a while, and if you haven't seen my video about that, you might want to check that out as well. So I worked as a digital pharmacist for the first part of my career here, and that was fun, it was great, but then things changed and got into retail pharmacy. And the specific reason why I got into retail was because I wanted to essentially make sure that I learnt the basics of pharmacy in Canada. I wanted to learn and understand how they do their insurance, how their prescription services work, how they're communicating with their physicians, and so on and so forth. Because I think that those things are very vital and very important. I don't know how anyone else feels about this, but working in any country, I feel like retail pharmacy is the best place to learn the basics. Hospital pharmacy can be very specialized, and different hospitals do things in different ways. So essentially that means that you have to kind of be very specific when you are working in a hospital. If you move to another hospital, they might do things in a completely different way. And then if you move from hospital into community, again, things could be completely different. Whereas community kind of sets the foundation, community or retail sets the foundation for how things work. So yeah, been working in retail, and I feel like the clinical pharmacist in me is like, hospital is where it's at. Hospital is where it's at. In hospital, there's so much room for growth. You actually use a lot more of your clinical knowledge, in my opinion. You get to see things a lot more. You get to see more advanced, complicated medical conditions and medicinal products used. And I kind of feel like that's kind of urging me and pushing me to want to try hospital pharmacy and give it another shot. I spoke about this in one of my other videos as well. The difference with Canada or North America in general is that a lot of hospital pharmacies require that the pharmacist does what they call a residency before they basically become a regular hospital pharmacist. So there's a residency program, which I think is the same as what we would call like the band 6 clinical rotation in hospital, and most hospitals are looking for somebody who has done a residency specifically in North America. So I think again that was one of the things that prevented me from applying initially into hospital. So I left hospital pharmacy in the UK. I was like, I'm not going back to that. Honestly, that was such a ghetto life, like having like 4 or 5 bleeps. So bleeps are like pages. Literally, there will be days where I'll be covering like 4 wards. So I'm doing cardiology, surgery. I think there was a specific hospital I was working at, and I was covering cardiology, elderly care, surgery, and like endo or something, endocrine. I was doing like all 4 wards. So basically, you'll start the day. I normally start the day. I'll go into my ward. Who are the new patients? Go through the new patients. Make sure all the patients I saw yesterday are seen, and get all the handover sheets, go to all the board rounds. And just imagine doing that for 4 hospitals. And then you have lunch. So lunchtime is normally around 1 p.m. And then like 3 p.m. comes and everybody's been discharged. So I remember this specific hospital, I would be on cardiology because that was for some reason the busiest ward. I'll be on cardiology, discharging the patients, and then I'll get a bleep from endo, and then I'll get another bleep from surgery, and then I'm running up and down, and it was absolutely exhausting, like the most exhausting thing ever. Those are some of the reasons why I was like, do you know what, hospital is just the ghetto. Like sometimes even when you're on call, you get a call from someone and say, oh, I've got this patient who's on vancomycin, and you know their vanc levels blah blah blah, what dose do you recommend? And I'm like, I was just having a dream about my future wedding, and here you are asking me about vancomycin levels. Like, I don't know. But essentially, I think it was, thinking back now, actually it was so fun. Like, you learn so many things. There was so much that I learned. I spent a lot of time in cardiology and admissions, and I think I learned so many things just in that time. And I was able to just grow as a pharmacist. Another thing I loved about hospital is we had drug lunches. Oh my God, I don't know how many, I'm sure most hospitals, especially teaching hospitals, probably do this, where, you know, there would be, not because of the lunch, okay, not because of the lunch, but I always had my own lunch anyway, but because of the fact that you were able to just sit there and learn from, like, you know, someone who is like a consultant in something, or like you could learn from like your pharmacy colleagues. It was so, I found it so good, and so, you know, just the ability to just like hear about something different in a day, you know, and having that as a CPD, you know, a continued professional development, you could basically add that to your CPD. I absolutely love that. I loved, you know, being able to, you know, build friendships with, you know, other medical professionals. So nurses, really great friendships with my nurses. I miss all of my nurses, like my pharmacy technicians and that I worked with, all the doctors I worked with. There was one specific hospital I worked at. Oh my God, I feel like that was the best hospital ever. Not to work at, but in terms of friendships and building like a great community. I was a junior pharmacist at that hospital, and we had a bunch of junior doctors that we would literally just all go to lunch together, learn about stuff together, laugh. We would, like, you know, do discharges together. I would, you know, be able to like call them out, like, are you really like prescribing this for this patient right now? I love that. I love the community sense the hospital had. So maybe hospital pharmacy is calling me, like, it's like, hey girl, I've been waiting for you, come back. So I don't know, I think it's something that I'm definitely going to be exploring, looking into. I feel like retail, maybe in the near future, hospital pharmacy might be something I'll be looking into, but retail it's fun, it's great. But is it something that I want to do long term? I don't know. I don't think so. I think there's also just a lot of like stress and anxiety associated with retail. I don't know whether that is something that everybody that works in retail feels, but I definitely feel like in hospital there was more of just knowing that there are resources available, so much resources available,